It's just teeny.
It could be worse. Western Minnesota and like the Fargo, North Dakota area have like bridges and highways closed. So
for sure.
As much as I hate it, I will say it's not as bad as it could be.
There's that. Hi, Andrew. Hello, Heidi.
Hi. Hi. 14, 15 people. It's only February of this
wow.
year, and so I'm not sure how many people wait for quite yet, 16.
We're looking like we're pretty good. I see Terrianne is here and Twee is here as well.
It's partially my fault because we have new people coming in, and I did not issue my yearly January threats to be on time.
I think we have sufficient. Yeah, I think we have sufficient.
That you make threats because you're so pleasant the other 11 months.
Right.
Cute.
Yeah. It's like when a little like troll doll or a plush doll like starts making threats at you. I mean it. Get here on time, everybody.
I'm not trying to get on your bad side, Jerome.
It looks like Anna and Kozar have joined us as well. So, Jerome, I would say go ahead and get us started.
Awesome. I've got my script up. Good evening, everyone. My name is Jerome Evans, and I am one of the co-chairs of the Public Health Advisory Committee. I would love to introduce you to my other co-chair, but we need to get someone signed up. Before we begin, I'd like to note that this meeting includes the remote participation of members as authorized under Minnesota Statutes Section 13D.021 due to the declared local health pandemic. I will now call this meeting to order and ask the clerk to call the roll so that we may verify the presence of a quorum. Go for it, Hattie.
Terrianne Jones.
Present.
Mary Pike.
Present.
Kozar Mohammed.
Present.
Lisa Nakotra won't be with us tonight. Anna Arkin.
Present.
Alicia Jackson.
Present.
Jerome Evans.
Present.
Andrew Crook.
Present.
Britt Culp.
Present.
Suad Salad.
Present.
Meredith Martinez.
Present.
Twee Kim.
Present.
Babette Apland.
Present.
Erin Hurley.
Present.
And Jolie Punjabi won't be with us tonight either. Okay. 13. Good quota.
Thank you, Hattie. Now, before we move on to what we would traditionally do, which is the adoption of the minutes and the agenda, there are going to be maybe some changes to the agenda. And Margaret, I think you were going to put in an amended agenda in the chat so everyone could see it.
Yes, and part of the reasoning for doing this is because we wanted to have most of our conversation before we did our breakouts. Ooh.
Yeah, as a reminder, this is a working meeting. I made you that promise last month, and we're going to stick to it.
That is a weird, like in my chat, only number 3 turned out in white print, and everything else is in a dark color. Can people read that?
I can still see it. It's still legible.
Okay. So I can read it out loud for those who are on the phone. We're going to, after we do the approval of the agenda and the minutes, we do need to approve our 2022 meeting dates, which were sent to all of you several times now over the last couple of months. We will have a couple of announcements. So me and Twee will do a couple of announcements. Then we're going to have Heidi Ritchie do her health commissioner report. And then we'll have a couple of discussion items on resident concerns, and then we'll do our breakouts so that really those breakouts can be uninterrupted, time at the end of the meeting. After the breakouts, we'll come back and do a report out of what we discussed and then be able to adjourn.
Perfect. I also see we've got an icebreaker question at the very top of the agenda.
Oh, true story. I did send that out.
I have the question.
So fantastic.
So we're gonna, so everyone, if you can see the agenda as decided, we're just gonna introduce each other to each other, or introduce ourselves to each other because we're still getting to know each other for this calendar year. The icebreaker question this time is, what is the one thing you are known for doing well or for being the go-to person for in your organization, family, or community? Again, that's what is the one thing, and really for the interest of time, I know how talented you all are. Please just pick one thing. One thing that you are known for doing well or being the go-to person for in your organization, family, or community. And I do, oh, you know what? I don't have the order by ward like I usually would. So I'm just going to go down the participants list. Okay, which means Alicia, you'll be first, Andrew, you're second, and then Anna, you're third. So then Alicia, what's something that you're good at?
Yeah, so hi everyone. I'm Alicia. I'm in Ward 10. So Whittier, parts of Uptown, a couple other places. So one thing that I am good at, and sorry about the lighting where I am, is organizing events. My family and I throw a lot of large dinners, helping out with communities and churches and community organizations. So I'm really good about the administrative side of organizing events, finding vendors, making sure we have space allocated, chairs rented, food organized, all those sorts of things. So that's me, organizing events. Thanks.
Oh my gosh, every community needs a talented organizer. I love that. Next we've got, and I'm gonna refrain from commentary on everyone's thing. Again,
good luck with that.
We've got Andrew Crook, Anna Arkin, and then Babette Apland.
Okay. Hello, Andrew Crook. I'm from Ward 13, which is Lyndhurst, Linnea, Palmasanos district. Ultimately, it's lifting things, anything requiring brute strength and ignorance, I'm really good at. And if those are fails, I'm quite a good organizer and logistics person. And that's something that my family comes and my colleagues come to me for.
Awesome. It's Anna, Babette, and then Britt.
Just want to point out that Erin's a fellow A as well. But hi, everyone. I'm Anna from Ward 8, Council President Jenkins's ward, and I am a planner. So kind of along the same lines as Alicia, but usually smaller scale events, good at getting activities on people's calendars to bring friends and family together.
So, Babette, Britt, and then Erin Hurley.
Oops, there I am. Hi, everybody. I'm Babette Apland, and I'm a member at large. And I think the one thing that I'm particularly good at right now in my work is forging partnerships and helping people in the different camps sort of come together around a common goal and vision.
Wonderful. Okay, we've got Britt, Erin Hurley, Mary Pike.
I guess one thing I've heard from my colleagues is I'm pretty good with connecting dots and resources and kind of thinking outside the box to kind of look at the bigger picture versus just trying to shuffle people from point A to point B, especially if it's not, going to be the best thing overall for them. But yeah, and maintaining the good connections I've made over the years, because you never know when someone that you used to work with a while ago can help out.
Nice. It's a lot of effort not to do commentary on my part. There's power in restraint. We have got Aaron Hurley, Mary Pike, Meredith Martinez.
Yeah, I'm Aaron Hurley, member at large. I would say I'll do a boring one and then I'll do a fun one. So a boring one, people in my world continuously come to me with insurance and payment questions, just all sorts of things. Someone called me, they got rear-ended by a non-insured driver, how to recover. So that's all day, every day, it feels like. But I'd say barbecue. I love to barbecue. My family raises cattle some years, and so that's something we grew up doing together. So yeah, I would say barbecue.
Awesome. Where is my? Here we go. Mary, Meredith, and Kozar. You're muted, Mary. You're still muted, Mary.
Muted. Sorry. Oh. Sorry, I thought I had unmuted myself. Hi, I represent Ward 3, which is Michael Rainville's ward. And like Alicia and Andrew, I am very organized. When our agency went into incident command structure, I headed logistics, and I just thought, oh, I found my home here. This is where I really want to be. And I always felt sorry for the planners. Margaret, I think of Margaret as a planner, and I always felt sorry for the planners, thinking they had a really hard job. Logistics was just fun. It sort of came naturally.
Yeah, logistics are tough. And Alicia is really good at them. And sorry, that's awesome. Next, we've got Meredith Martinez, then Kozar, and then Swad.
All right, good evening, everyone. I'm Meredith Martinez. I am representing Hennepin County Public Health. I'm the Family Health Area Manager there. And I will pick a non-work related thing. This is kind of weird, but I'm a really good cleaner. I'm really good at cleaning and like purging, like getting rid of stuff. So if you ever need somebody to, well, I'm not going to offer that up, but I will just say people have been known to ask me for their help. So, yep, that's what I'm good at.
That was a good decision there. Kozar, Swad, and then Terrianne.
Kosar Mohammed, representative for Ward 6. I think for a work-related piece, I think people often come to me when it comes to building community trust or really dealing with difficult clients, and then really being able to get some buy-in or being able to negotiate in a way that ends up in a positive manner for both parties. And then for community and friends, I think I literally envision everything in a really strategic way. I have a planning background, so everything I think of is always creative and solutions and design. So I'm always thinking about, okay, what other areas can we plug into? And I think oftentimes that serves as a resource for folks, which can be exhausting, but I enjoy it.
I feel that. Okay, Swad, Terrianne, and then Twee.
Hi, everybody. My name is Swad. I'm representing Minneapolis Public School. Something I'm good at, I would have to say something unwork related. I would say assembling stuff together. I just visualize. Not that I enjoy it, but I think at home I'm the point go-to when it comes to putting things together.
Nice. Okay, it's going to be Terrianne, Twee, and then whoever phone with the last two digits, 9-3.
Hi, I'm Terrianne Jones, Ward 1 in Northeast, and I too am a very strategic thinker. I can often see I think 4 or 5 steps down the road of where something's going to go. So that's always kind of fun. It's sort of like having a crystal ball sometimes, and sometimes you see things coming that you know are not going to be good, or you suspect, right? And then you try to change trajectories. But and the other thing I would say is I'm also a connector. I am really good at like connecting people, and then getting out of the way, and just letting people run with connections that they make.
Very cool. It's going to be Twee. Whoever on the phone is the last 2 digits 9-3, and then whoever's on the phone the last 2 digits 8-8.
Hi everyone, my name is Twee Kim. I represent the University of Minnesota. Not work related, but kind of. I used to work for a public health nonprofit, and every year we plan like an annual conference, and it's pretty big, getting together like the epidemiologists in the nation, whatever. But not work related, I always sent out a list of restaurants for each of the cities that we went to, and I researched like what they're known for, their price range, and sent it out to my coworkers. So this year, as they're gearing up for planning, they emailed and said like they missed my lists of restaurants.
Aw. Okay, on the phone, last 2 digits 9-3.
Hey everyone, I'm Jake. I am just a member of the public. I work at the VA hospital as a nurse. This is actually part of my class. I have to attend a public health meeting, so I'm just doing this. I would say one of my strengths is being a patient advocate. I do that a lot at work, so I like to advocate for my patients.
Awesome. Well, welcome.
And you picked the right public health meeting because we are bunches of fun, Jake.
I can tell I'm excited. Thank you for having me.
Yes, welcome. Okay, it's whoever's on the phone with the last 2 digits 8-8, and then Dr. Eardley, and then Hattie.
Hi, my name is Sharon Horace, and I am a retired nurse, proudly retired from Hennepin County Medical Center, a psychiatric nurse. And I think the thing that I'm best with is connecting people to resources. That's what I do best.
Wonderful. Welcome. I did misspeak. Dr. Eardley, you're going to be next after I see a Sharon Horace.
Oh, that's me, 8-8. That's
Okay, great.
the same person. So I guess I'll add I'm actually live in Ward 8. So that's my only addition to say.
Oh, wonderful. I reclaim my apology. Dr. Eardley, go for it.
My turn?
Yes, please.
Okay, it's great to be here and to meet all of you. I'm Dr. Eardley, and I teach public health nursing at Metropolitan State University, although my alma mater is the U. Yay! And I'm known for being really good at advocating for the most vulnerable people and for linking them to supportive resources. Thank you.
Yes, thank you.
Dr. Eardley, do you get to work with Brian Goodroad?
Oh, yeah.
He's one of my favorite coworkers in the Positive Care Clinic.
Oh, I'll tell him that I was at a meeting with you. Remind me your name.
It's Britt.
Britt, okay.
Yeah. Oh, he'll know. He'll know. I think I'm his only Britt right now. He's wonderful.
Yeah, he is. We are so fortunate to have him teaching with us.
National treasure.
Connections. That's wonderful.
Yeah.
Our last 4 are going to be Hattie, Margaret, Noya, and Heidi. Should probably say Commissioner Ritchie because I haven't met you yet.
Hi, everyone. I think where I work now, which is the City of Minneapolis Health Department, I'm probably most well known for being able to navigate city processes and procedures and just get things done or connect people with the people that can get things done. Since I've been there for 16 years, it's just part of institutional knowledge, I guess, that I've been blessed with.
I can back that one. You're wonderful. Margaret, Noya, and then Commissioner Ritchie.
Hi, I'm Margaret, and I work for the Minneapolis Health Department, and I am known, both in our organization, in our family, among friends and other communities as the question and answer lady. So people come and they ask me all kinds of questions, assuming that I know the answer, or like Hattie, that I can point them in the right direction to get an answer. And sometimes that means that I'll find the answer myself and give it to them. So the other thing a couple of people mentioned is I love to connect people. So yeah, so that always brings me joy to hear something over here and know that something's happening over here and then get those folks together.
I'm going to break my rule of no commentary because, Margaret, I think we have an example of you doing that coming up later in the agenda.
Yes, we do.
Noya, are you available? Maybe not. I did see I see the yellow icon by her name in the participants list. She might have stepped away. And then Commissioner Ritchie, are you available?
Absolutely. I'm so grateful to hear all of these strengths that everybody has. My name is Heidi Ritchie, Interim Health Commissioner, and I am freakishly good at recognizing abnormal heart rhythms. So take that for what it's worth, but also I have a steel trap of a memory. So those are the two things that I can offer.
Very cool. Welcome. Happy to have you. Let's see. Let me open back up the chat because I think now we're circling back to the approval of the agenda and the minutes. Okay, now this is a little weird because usually we do the approval of the agenda and the minutes in one roll call. This time I need a motion to approve the amended minutes as seen in the chat. Oh,
agenda.
I'm sorry. I apologize. Amended agenda as seen in the chat. And so Andrew, you're unmuted, and so you get to make that motion.
I move to approve the amended agenda as seen in the chat.
And then Britt, you're also on my screen, so you get to second that motion.
I wasn't even unmuted. Anyways, I'll second the motion.
And then is there any discussion on the motion? Okay, seeing none. Hattie, will you please call for approval?
Terrianne Jones,
I approve.
Mary Pike,
Approve.
Kozar Mohammed,
Approved.
Anna Arkin,
Approved.
Alicia Jackson,
Approve.
Jerome Evans,
Approved.
Andrew Crook,
Approve.
Britt Culp,
Approve.
Suad Salad,
Approved.
Meredith Martinez,
Approved.
Twee Kim,
Approve.
Babette Apland,
Approve.
Aaron Hurley.
Approve.
So moved.
Wonderful. We just need to do this 2 more times in a row. Next is the approval of the minutes from last month's meeting. Did anyone have any questions on those minutes or discussion? Okay. If not, I think, do I need a motion for approval on this one, Margaret? Okay. Aaron?
Yeah, and sorry, Jerome, just to clarify, I think it's 2 sets of minutes, which we can do in one vote. So
Okay.
I believe that there should be the minutes from November because last month, remember, there was a mix-up of there was like the wrong minutes or something, and then just last month. So 2 sets of minutes can be approved in the same motion.
Okay, we're really getting everything sorted. Aaron Hurley, I'd like a motion to approve these 2 sets of minutes, and then Twee, I'd like for you to second.
So moved.
I'm sorry, I second this motion.
Wonderful. Masterfully done, everyone. Hattie, please go for it.
Terrianne Jones,
Approve.
Mary Pike,
Approved.
Kozar Mohammed,
Approved.
Anna Arkin,
Approve.
Alicia Jackson,
Approve.
Jerome Evans,
Approved.
Andrew Crook,
Approve.
Britt Culp,
Approve.
Suad Salad,
Approved.
Meredith Martinez,
Approve.
Tui Kim,
Approve.
Babette Apland,
Approve.
Aaron Hurley.
Approve.
Okay, it's all approved.
Wonderful. Well, you said all approved, but we actually have one more thing to approve. And it's the approval of the 2022 meeting dates. Is there any discussion on those dates? We've all seen them a couple of times by now, but the clerk needs us to formally approve them. Okay. Seeing none, I'm going to ask Anna Arkin to make the motion, and then for Meredith Martinez to second.
I motion to approve the 2022 meeting dates.
And I second the motion.
Wonderful. One more time, Hattie.
Terrianne Jones,
Approve.
Mary Pike,
Approve.
Kozar Mohammed,
Approve.
Anna Arkin,
Approve.
Alicia Jackson,
Approve.
Jerome Evans,
Approved.
Andrew Crook,
Approve.
Britt Culp,
Approve.
Suad Salad,
Approved.
Meredith Martinez,
Approved.
Tui Kim,
Approve.
Babette Apland,
Approve.
Aaron Hurley. Okay, now
Approve.
we're all approved.
Woo! We did it, everyone. We're gonna have a very happy city clerk. Hopefully, we'll see how the rest of the meeting goes. Next, we have some announcements. I think first from Margaret and then from Tweet.
Yes, thank you. So here's one of those examples of both connecting people as well as answering a question. We did receive an email of a resident concern regarding the masking mandate, and that concern was emailed to the health@minneapolismn.gov email address, which is just our general email inbox. And it was forwarded to me because it was actually addressed to the Public Health Advisory Committee. And one of the things that I do as kind of the point person for the PHAC is I hear those concerns. I try to answer some of those concerns, especially if it's something that I am able to do. If it's something that it requires it comes to the committee for discussion, certainly we can do that. And I'm so sorry, my phone's out of reach and I can't get a hold of it to shut it off over there. So you may be hearing ringing in the background. So I was able to respond to this concern from Ted Burrow, who was worried about the way that the mask mandate is kind of squishy in terms of how enforced it is, where it's enforced, who gets to make the decisions about it being enforced, why it isn't just, a blanket mask mandate. And I consulted with the emergency regulation. I consulted with Heidi. I consulted with Louisa, our manager of epidemiology, research, and evaluation. I also consulted, or Heidi connected me to people in the mayor's office, since the concern was also from the mayor's office, and was able to respond to his concerns to say, hey, I just want to tell you, here's what I did. I consulted with these different people and I'm trying to answer your concerns. One of the things that he had just made an error about, and how would anyone know, is that he had assumed that the Public Health Advisory Committee was a body that had recommended the mask mandate and how it kind of played out. And so again, that's part of my job, is to remind people what is the role of the Public Health Advisory Committee, who are they able to provide recommendations to, and just sort of set that record straight. So after I was able to respond to that, I did tell him that I was going to forward the information to the Public Health Advisory Committee, which I did. I sent the 2 responses to you folks so that you knew sort of what the unfolding conversation was. But I just wanted to bring that up because I know sometimes emails get lost in boxes, and you're not always able to read everything that comes in a day or a week, and wanted to let you know that would be a typical process for a resident complaint. We've also had resident concerns that have come forward to the committee, and people have asked to be able to provide a presentation or ask more questions or bring up an issue that's happening in their neighborhood. And when that happens, we would create space for them on the agenda for them to be able to do that. So I just wanted to give you that heads up because it doesn't happen too often, but you should know what's the process for that.
I also appreciated how the letter and your response raised the question in my mind, well, who should this letter have gone to? Who is helping to advise the mayor on these decisions? Because if we'd had an easy answer to that question, you could have maybe just clicked forward and then the resident could have gotten their question resolved maybe in a faster way. But certainly not in a more comprehensive way. So thank you very much for that, Margaret. Okay, Twee, you're up next.
Yeah, so I am a part of the Division of Environmental Health Sciences at the School of Public Health. And so we are hosting a seminar series on important environmental health issues that have racial equity implications. And so one of the organizers reached out to me because she heard about this committee's work on lead prevention and asked, if we would be willing to present on one of these seminars. And so I reached out to Jerome and Margaret connected me with someone at the health department who's able to give the presentation. From what I heard, it's their 4th time giving this presentation on lead, so they're really excited about that. The seminar is supposed to be sometime in March or April, and it's open to students and also members of the public. So if any of you are interested in joining, you can reach out to me and I can forward that information along when it becomes available. That's all I had.
Fabulous. Thank you so much, Twee. Oh, go ahead, Margaret. I see your hand.
I realized that I jumped ahead in the agenda and I did my resident concern. So when we get to that point at the end of the agenda, we can just skip over me. So I'm so sorry because I did have 2 quick announcements that I wanted people to be aware of. One is that the council members who have vacancies on the Public Health Advisory Committee, which include wards 2, 4, 5, 9, and 11, are all aware of the openings. They're all aware of what the process is for filling those openings, and they're very excited that the vacancies will be posted on the website for the spring cycle, which should happen in the next week or 2, I think. So sometime early in March. And I just wanted to let you all know, because if you know people that either live or work in those wards, please encourage them to apply so that especially our new council members, have folks to be able to consider for these positions. And those are, all wards are super critical, but we know that those wards in particular really need to have a voice at the table. The second one is that the city clerk is letting us know again that boards and commissions meetings will continue to be online for some time, even though the mayor did basically tell folks that you should start returning to work as of February 14th. That doesn't necessarily mean that our meetings are going to become in person for some time. So they will first start with city council members and city council meetings and figuring out How do we do that? Is it a hybrid? How does the hybrid work? What are the rules that have to be in place? And then somewhere much farther down the line will be boards and commissions. So I'm going to guess that probably for the rest of 2022 will be online. And I just wanted to let you all know that.
Thank you very much. Okay, so we had a couple of announcements from Margaret and then also from Twee. Was there any discussion on those announcements or let's just say interesting items? Okay, not seeing any discussion there. I'll remind everyone that we have to keep the chat focused on business just before we start getting chatty. Because we have been slapped on the wrists about that before. And then next, we've got our Health Commissioner report. Commissioner Ritchie.
Thank you so much, Chair Evans. I'm so happy to be here with you. My first official meeting as the Interim Health Commissioner for the Public Health Advisory Commission. I have come in front of you before in various roles. I've worked for the city like Heidi for 16 years. I started as an associate in the council office for Ward 9 and served there for about 8 years and then worked another 4 years for the Ward 3 office before moving into the mayor's office as the policy director with a public health portfolio on top of managing the policy team, as well as managing the mayor's budget for the time that I was in the office. So I've since moved over as interim health commissioner. A little bit about my educational background. I have a bachelor's degree in both international relations and political science from Augsburg University, a master's degree in leadership from the same university, and then I have a bachelor's in nursing from Concordia with a public health nursing certification. So that's a little bit about that piece of my background. A little bit more about me. I wanted to just share, let's see if I can find it, a window with you all. I don't know if I have it up, but
I'm seeing panicked looks.
Yeah.
Margaret.
I'm sorry, Heidi, you can't share anything that we haven't publicly posted on our website. So you'll have
don't
to talk
panic,
this.
Margaret.
Yeah, you can talk it through, but you can't share. So everyone shut their eyes. No.
Shut your eyes. Thank you.
Nice try.
Okay, so I'm not sharing. Am I sharing?
Nope. Yeah, you are. So you got to stop.
Oh, gosh. Difficult. The rules.
It
very
always
strict.
This meeting for sure.
Very, very strict.
By the way, I was going to tell you how well run this meeting is. I have been to many advisory committee meetings and other meetings, and this is like on point. You've got your seconds lined up. It's just like great.
That just came right after you got shut down there? That opinion changed after you were told not to share?
No, not at all. So basically what I was going to share is the health department, and Margaret and Hattie have already seen this, but we look at strength finders. It's an assessment to look at what your strengths are as, you know, a person and a leader. And so I went through this as part of my nursing curriculum and shared it with my staff when I first had our all staff meeting in January. And so there's 5 strengths, I guess you could say, or indicators. And one is achiever, and that is motivation, drive, and determination. Strategic, sort through the clutter, determine the best route forward. Learner, the process of learning for me is fascinating. And input, the desire to know about everything and ask questions that propel learning more. And then individualization, which means that I really am intrigued by the unique qualities of each person and really feel like their unique strengths is what lift us up as a community. So that was like the kind of things that I wanted to share personally about who I am. You get the background, you've got my education, you've got my profession, but as a person, those are the things that I try and focus on and bring forward and collaborate on. So I wanted to share that. Sorry that I didn't follow the proper procedure, but I talked it through. So if there's first of all, if there's any questions on that, I'm happy to answer. And then I do have a couple more updates.
Okay, fabulous. Okay, so questions on that part first. You can raise your hand, you can flail about if you'd like, we'll see that. Okay, seeing no questions on that, please move into your next set.
Great. So I'm going to take that as a good sign. I've been asked to talk about the hiring of the health equity manager. We have hired the health equity manager, and they will be starting, I believe, either at the end of the month or the beginning of March. And so I'll get you more information on that person. I had an email from Noya, who was out in Mexico on vacation, well-deserved vacation, but I don't know where it is, so I'll send that to you. But yes, indeed, that person has been hired. We are so excited. The COVID update, including vaccination, testing mandate, and masking mandate. As you know, the vaccination mandate for our places that serve food and beverage has been lifted as of last week. I'm going to be having a conversation with the mayor and with other subject matter expertise from CPED and HR and others to talk about the mask mandate citywide tomorrow. So we should have more information tomorrow on that. We're also looking at the mask mandate for city buildings and city employees. But we want a little bit more data on that because we just rolled out the testing and vax policy for employees for 911 and MPD. So we'd like to collect a little bit more data on what that looks like and how that's proceeding before we just go ahead and recommend lifting the mask mandate for employees and buildings. Let's see, what else? Any questions on the COVID vaccination, testing, masking mandate?
No immediate, well, Margaret has one. I feel like I've been rope-a-doped a couple of times by COVID now. And so just because we're on the decline now, doesn't mean that something's not waiting in the wings. And so I hope that's part of the consideration in your discussions. And then Margaret, it'll be Margaret first, and then Britt, if you still have a comment, I'll call on you next.
Yeah, and mine is just a clarification because I'm writing notes, meeting notes. You talked about the first part of the mask mandate that you were going to be meeting with several folks across the city enterprise. What was the difference between that announcement and the mask mandate for city buildings?
That's a really great question. There are two separate emergency regulations. And so one has to do with masking in our city buildings and for our city employees. And the other one is the masking mandate that is in spaces of public accommodation.
Oh, that's it. Thank you.
Awesome. Very nuanced question. Nice catch, Margaret. Britt, did you still have a comment?
Well, I was venting about all the dang variants and also what led to the vaccination status or like showing a vax card or showing negative testing proof? What led to Minneapolis doing away with that so quickly? It felt like it was just here for a blink.
Yeah, I think that's a great question too. I think there's always a balance between what we're seeing, our businesses and other organizations going through, and then what we're seeing on, the public health data and science side. And so what we saw was a increasingly stabilizing trend in the way that we wanted it to go in order to remove that particular requirement. And I think we really, thought hard about how we were going to put those two in place, like how we were going to use the masking tool versus the vaccination testing tool. Because, one, obviously, you're asking someone to wear a mask. The other, you're asking them to be a little bit more invasive in their own body space, right? And so I think we were really, really trying to just balance those two. And once we saw the trends going in the way we wanted to take away, or wanted to remove that requirement that was a little bit more invasive and required a little bit higher level of consent, I guess you would say.
That makes sense. And I appreciate that explanation because especially with this being recorded, it just, for a lot of people, it just felt like it was like randomly removed. And it's like.
Thank you. Aaron?
Yeah, thanks. I just had kind of a question. I mean, as you know, we've been doing this for almost 2 years now. What would you say Minneapolis has done well? And what lessons, what opportunities might exist to do it better in the future? If this crops up again, say a new variant in 5 years or something like that.
I think that's another really great question, and it's one that not only Minneapolis is grappling with, but local public health agencies and state health agencies, and even on the federal level. That's a discussion that is taking place. One of the things I can tell you is that the state has put forward some money for a local public health infrastructure grant that will seek to address some of this stuff and what are the lessons learned and how do we better need to address the infrastructure in order to stave off a wave of another variant or even just another pandemic. So that's definitely something we're looking into, and we hope to hear back from the state in March on the award of that money in order for us to move forward to better increase our infrastructure locally.
Thank you.
Great questions from the committee. I'm learning, which I. Are there any other questions for Commissioner Ritchie? Otherwise, we'll move to the next item, which is actually our breakout discussions, because neither. Well, okay, I'm gonna hold off on that. I'm not gonna call an audible. Let's close out this section, and then we'll see if there are any resident concerns, maybe that are not included on the list that was provided to me ahead of the meeting. Okay, and I saw someone's hand up.
It was.
Okay, go for it, Brett.
Yeah, because this actually does kind of involve Heidi because she was a pretty crucial role at this. And last month I had brought up the scenario of someone who we were working with in positive care who had their car towed when they were seeking help during a crisis, and their car happened to be in one of those metered spots in front of HCMC where it said no standing between 7 and 9. And the security at our hospital had this idea that presenting hospital paperwork proving you were receiving care at the time your car got towed would waive fees, but unfortunately that's not a policy yet. And I had started a conversation with my ward representative, Robin. And Heidi, as I was telling folks, I don't know if you were in the Teams meeting yet or not, but we had intended to try to connect at some point, like mid this month, but with everything that's happened with the killing of Amir Locke and the protests and demonstrations, it's did kind of get moved to the back burner, but I intend to reach out to her again to restart that conversation just to see if City Council can create any sort of motion so folks don't have to be dependent on anyone who's got connections to the city office for these rare crises, because it actually happened to another patient shortly after, and I'm like, I don't know how many favors I can ask, but let's start talking to our council members. So I'm hoping to have another update on that conversation next month with the dust settling a little bit more, because it is something that has impacted at least more than one patient of just our clinic. So it begs the question of how often is this happening at the other area hospitals for people who go in to get psychiatric care or just go to the ER and the wait is way longer and you're not it's not in your head that you have to like refeed your meter and these weird signs about no standing getting towed. So, and there are people who live in their cars because shelters aren't safe for everybody. So.
Okay, yeah, I would say keep bringing it up and let's keep discussing it and let's not wait for the dust to settle because it never seems to really settle here in Minneapolis.
No, I didn't mean it like that. I was just like, being patient with Robin still getting settled into her new role as a city council member and having another police killing too. That's definitely sparked more conversation. So
thank you, Brett. Margaret, your hand's up.
I'm working on getting my hand down. I was wondering if Heidi, did you want to address any of the other couple of bullet points that we had sent you regarding the mayor's change in executive power? And if there was any other like kind of enterprise news, city enterprise news.
Sure. So I think that we're going to have a lot more information on the governance structure changes in the next couple of weeks. So the mayor had convened a governance structure work group, and they are bringing forward some options for the mayor to consider. And once the mayor makes a decision on like where he wants to go in terms of those options, then it'll be the next step will be for him and others, leadership, to work with the council to craft an ordinance that would put these changes in the code. And so I think in the next couple of weeks, like I said, we'll be looking at what the mayor's decision is moving forward on which kind of structure he wants to look at. And so, for example, they've been looking at the Duluth structure with the city manager, and then they're looking at the St. Paul with a deputy mayor. They're looking at a bunch of others. And so those options will come forward and the mayor will make a decision and then start to work with council. One thing that we've been trying to work through is, again, what the role of the advisory committees are. And so I think that's something that's probably really relevant to you all, as I think they're moving forward with trying to standardize advisory boards and commissions and really just make sure that they're staffed and resourced the way that they should be and can be most effective. And so I know that that's part of the conversation with this governance structure conversation. And then also the other piece is how council interacts with staff. And so that's something that we're working through as well. And so, stay tuned. I'm happy to answer any questions that I can, but it's definitely a work in progress that is changing and ever evolving.
Okay, thank you. We did touch briefly on that last meeting. I'm wondering about what changes were coming and what they were going to look like. So I appreciate those insights. Are there any questions before we move to breakouts? This has been a really great discussion. Good job, everybody. Okay, I'm not seeing any. So we're going to move to breakout rooms for discussion. I would encourage you, if you need a break, to take 2 or 3 minutes after you're in your breakout session to stretch and get ready for some excellent conversation and discussion on racism as a public health crisis, food, drink, and medicine, and environment and mental health, or whatever it is that you find you want to discuss and work on. If you are not in breakout, I don't know if anyone has not been assigned who doesn't know where they're going to go. You will stay in the main room, and then you will have a conversation, probably with Heidi, about where you would like to go. And then that's where you'll be off to. Margaret? She could be correcting me, so I want to make sure.
No, I'm not correcting you at all. I am reminding people, and I'm going to put it in the chat, that when you go into a breakout room, and Hattie's probably going to have to correct me on this. Hattie, how do we put up the slide for the individual breakout sessions?
So someone within the breakout session just shares their screen.
They can do that. Okay. So I will put those slides in the chat because that's an appropriate business function. And in each breakout session, what you will need to do is someone will need to grab that slide and share it for like, I don't know, a few seconds so that when the recording
Yeah, so the
can
little
be broken
thumbnail
out into
capture
those. Yeah.
Screen. Yeah.
Yeah. So that when the recording is finalized, that they know that there were these 3 different sessions that were connected with the Public Health Advisory Committee and they all get grabbed together. Is that right, Hattie? Did I say that right?
It is, although I thought there was an issue about some folks not being able to hit the recording button.
Yes.
Yeah, and
we
I
were
see
gonna have-
Babette's hand up too.
I believe you were going to have Margaret, Hattie, and Heidi in different rooms to record the meetings. Am I misremembering our conversation, Margaret?
That sounds familiar to me, only I can't be in a subgroup. I have to stay in the
So here's a $64,000 question. Can I jump into a room and start the recording and then jump out of the room and start a recording in another one?
We could sure give it a try. Yeah, I've never been in a sub group. So I don't know what you see.
Hattie, I think your microphone's not working. I can barely hear you. Is anybody else having this issue?
Nope, there she goes.
Is that better? Sorry, I had my microphone on my head.
Yeah, may I suggest for this sausage making session that the rest of the committee go and take your break now. And then we will assign
what kind of a session was this?
Can I just mention one thing very quickly?
Yeah.
Yeah. So I just, and it's just a quick clarification as we go into our breakouts. So I understand that one of our objectives is to prioritize. And so within each of our breakouts, we'll be looking at how do we prioritize and narrow our topic. But one question that I had after our last meeting was, are we also, as a larger group, going to be prioritizing among the 3 areas? So as we look at what we want our focus to be and what we're going to tackle, are we going to be also prioritizing among the 3 areas? So it's just really a process question.
It's a good question. It is in anticipation of a problem that we don't have quite yet, because right now the racism as a public health crisis group is much farther ahead than the other groups in terms of coalescing around a particular policy proposal or an action. And so I would anticipate that the policy or a request for action from the broader committee will come from that group first. And our other 2 subcommittees are still almost in those early forming stages. So I would say very good question. It might come up as a problem in a couple of months. And so we can revisit that then. But that would be a good problem to have. The committee wants to do too much. Britt, your hand's up.
I think I want to springboard off of what Babette was asking. And one thing I think we've all noticed within the subcommittees is the amount of intersectionality there is. So I don't foresee, like as each subcommittee is prioritizing something, I don't see the 3 subcommittees having to wonder which of their priorities is going to be even further prioritized, because I feel within this group, we're all pretty smart and creative enough where we would be able to figure out how to present this intersectionality of a priority, I think.
Yeah, I think we'll be good. I think our immediate concern is literally like recording the subcommittee meetings and getting these screens on the thing. So committee.
I will let the sausage making continue with that.
Go take a break. and then hopefully when you come back, you will be in your breakout room and you will have a screen that says Public Health Advisory Committee being shared in your group. Does that sound good? Awesome.
I have one quick question. What time do you want us to come back?
Oh, let's say 7:50. 10 minutes. Seems good.
Wait.
Oh, sorry. I meant back from the breakout room.
Yeah, that's what I meant.
Okay. Okay. I was
Yeah.
like, wait, what?
No, I meant after the breakout. Like, what time do you want everybody to come back, reconvene? Yeah.
Gotcha.
Okay.
And Hattie, I just sent you an email. It seems that I cannot post something into the chat like an attachment. So maybe only you can do it as the organizer? So I just emailed you the slides.
Yeah, I'm trying to too. Trying a couple different ways.
We know the commissioner can share her screen, which is good. So that's one. If we're able to email Heidi,
I can share my
I
screen.
know, but I don't want to violate meeting law. Now I'm nervous.
No, the subcommittee title slides are required by the city clerk. So that's the difference, is that when we break out into these subgroups, that there is a, kind of a notice that it's like, okay, here's the part that's now going to be this subgroup's conversation. So Heidi, what I'll do is I'll send you the slides as well.
Okay, that makes sense.
And
then, so when we get into breakout groups, then I have the slides and I share my screen and I hit record.
You're on it.
Share the slide, yes, and then hit record, yes.
Steel trap.
Right.
I like it.
Steel trap. All right, Jerome, I'll share them with you as well.
Okay, I don't think I'm able to share my screen.
Oh, bugger.
Yeah.
I wonder if Meredith Martinez is. She's on team, she's got Teams as an app that they use at Hennepin County. I don't know.
So do,
maybe.
Okay, you know what? I'm just gonna try it and let's just see what happens. Oh, okay. I can share my screen.
Oh, look at that. All right.
So send them on over. I can do that. I don't know if I'll be able to record, but we'll find out together.
So if you see the little 3 dots.
Yes.
If you click on that, you should be able to go all the way down and there's like the recording stuff, right? Right now it says stop recording because we're recording. So hopefully when we're in breakout rooms, we can use the same thing and do start recording. If not, I guess, the ethics officer will come for us.
Yep.
Yes, they will. So Jerome, what group are you going to be in?
I will be in not racism as a public health crisis for this one.
Okay.
Because I think that's the larger group, and so it's probably more important that they are done by the book, right, and that they are definitely recorded.
Yeah. And Heidi, do you want to sit in on that group?
Yeah, happy to.
Okay. Sounds good. So then, Jerome, go ahead.
Oh, and so I was just gonna say, I will go into whichever one maybe has the least number of participants.
That's a good question. I know the last time I was in environment and mental health, and it was just me, Terrianne, and Aaron Hurley.
Okay. Have we sent people away to breakout rooms?
And Twee is joining that one too. So there's 4
Yeah,
in that
so
one,
now-
and there's 4 in food, drink, and medicine.
Great.
Okay. Can we get them in their rooms though?
Sure. You want me to beam them over?
Yes.
Do you want
That includes
Jerome?
you too. So do you want me just to ask the other folks who are left in the room after you leave?
Yeah, that'd be great.
Okay.
Jerome, so which one are you joining?
Food, drink, and medicine.
Oh, okay.
Are you sending the slides email?
Yeah.
Okay.
I'm working on it. Come on. Yes, select. Okay, here we go.
Okay. Send me the slide too.
I'm working on it, man. I'm working on it.
Okay.
All right, I am going to step away.
Okay. Mary, why are you still here? Let's see. You're supposed to be in food, drink, and medicine, right? Oh, she's gone. Okay. So, let's see who's left.
Swat is left.
Oh, Swad, what do you know which group you want to be in?
I wanted to be in the environment and mental health.
Okay. Let me beam you over there. See you
Thank
later.
you.
Mm-hmm. And then we have two guests, right? Is it Jake?
Yes.
Are you familiar with the rooms that we're going into?
No.
No. So there's racism as a public health crisis, a group that's talking about that. And then the other is food, drink, and medicine, and that's about access to food and water, intentional and unintentional drug use, vaccinations, isolation, dentistry, healthcare services. And then environment and mental health, climate change, air quality, mental health, sexual exploitation, public safety.
Let's do food, drink, and medicine.
Okay.
Thank you.
Well, you know what? After all that talking, I can't beam you anywhere.
Oh, that's fine.
I'm sorry.
Thanks for trying anyway.
It's just, yeah, I don't know what they're doing tonight, but it's all grayed out. Anna's still not back. So you can just have a break. We're going to reconvene at 7:50. So we're going to bring the group back at 7:50 and then they'll report out what they've done in their work groups at that time.
Sounds good. Thank you.
Okay. And that's the same for, is it Sharon?
Yes, I
Okay.
actually have Teams, but I'm not sure exactly how to get into your meeting. So,
Yeah, you'd have to have a link to join.
yeah, and I don't have that.
Okay.
So that will be fine.
Mary,
And
I see you're back. Oh, I'm sorry. Go ahead.
Yeah,
Sharon.
I was going to say, and I'll just rejoin the meeting, you know.
Okay. Yep, at 7:50. You can just hang on or,
Mhm.
put yourself on mute and go have some coffee or something.
Patty, when I click on join room, I get a black screen. I can hear Britt speaking, but I see none of the controls like mute, unmute, camera. I just get a black screen. So I have to go back and join the meeting, and then I see you and I get the join room option. I've tried both the one in the upper right, or excuse me, left quadrant of the screen and the one in the lower middle that says join room. Neither works. I'm gonna try the resume arrow again. If it doesn't work, I'll be back.
Okay, thanks. Anna, are you? Mary just looks like she's on hold.
Oh, this was so much easier than back in October where we all had to log out and log back in.
Oh, good memory. And I can see everyone's faces moving. That's nice. I got frozen in the subcommittee meeting, but everyone was at a very good pose, so it was fine.
Jerome, I was frozen on you like in an eye roll pose. It was kind of funny.
I hope you took a screenshot. I wouldn't.
It was tempting, but I expected everybody else not to.
Well, welcome back, everyone. I hope you had a productive subcommittee working session. I know that I did. I'm feeling more energized. Once again, that same energy that I think we were experiencing towards the end of last month's meeting has washed over me yet again. Let's hear some reports on what people were talking about. And we just ended our meeting asking about what the environment and mental health group was talking about. So why don't we start there and see how that went? And let's say 2 or 3 minutes, because we gotta get out of here by 8.
Terrianne, do you want to kind of chime in with a couple of the points that we talked about?
So we were in the group with the environment, and we out of our whole list, which was huge things, we've really, the last 2 times we've talked now, really kind of zoomed in on really focusing on mental health, access with providers, who is a provider, who's not a provider, access to providers who look like the people they serve. And one of the conclusions that we came up with, thanks to Margaret steering our conversation, so thank you to that, was we need more information. We feel like the Public Health Committee, we need to just understand what is going on, what is this relationship with Hennepin County in regard to some of this initiatives they have around mental health, and how can we just educate ourselves on where the people that are out there doing the work, what do they see are the gaps, what are the needs, so that we can even just understand the landscape. I think that was your word, Margaret, like how do we of what's going on, and then to discern what is the role of this committee in an advisory capacity. I mean, we can clearly see all the needs and all the issues and the gaps, but we're just outside observers, right? It would be really good to hear from people. And Margaret had even suggested a panel, right? We could kind of pinpoint who would we want to invite. I'm guessing it would be to a meeting, a PHAC meeting, and, you know, really just get some basic education as a group on what's going on and where we fit in. Margaret and everybody else add in.
We unfortunately won't have time to add in.
I talked too long, sorry.
It's okay. Go ahead and finish off, Terrianne, and then
that's it. That's all. That's all.
Okay.
Can I just say, so we did do a kind of a long presentation on mental health from the county.
Right.
And I don't know if it would be helpful to share those slides again, or maybe to talk about having like a second step might be to invite some actual mental health providers into a panel to talk about that.
That's what we're talking.
After we've had sort of the overview of like, here's what we're working on, like the big mental health picture in building capacity and access and all of those like a million activities that were in that proposal. And then maybe hear from providers and families or individuals.
Mm-hmm.
Yeah, I think we really zeroed in on some specifics about that. So maybe we could even take this conversation offline and be able to throw some suggestions back and forth, and then be able to come next month with even some like a slate of names, you know, as to who would we want to invite. Do we want to move forward with this? And that goes back to that question that somebody had asked earlier about prioritizing. How do we prioritize what we do next?
Okay, Britt has a hand up, and then I'd like to hear from the Racism as a Public Health Crisis group. You're muted, Britt.
I could have sworn I hit up. Sorry. I have a resource for where you can start with if you're looking for providers that are representative of the community members that they serve. and also some of the struggles with reimbursement and all that. Look into Minnesota Care Partner. It's kind of on the border of Minneapolis and St. Paul, more in St. Paul in the Midway area, but they also have contracts with Hennepin County CPS with having BIPOC parent educators through the grant that they have, and then also in their substance use disorder program. It is, if not fully, majority BIPOC counselors staffed, and then they also have like therapists and arms practitioners and CTSS practitioners. And the owner of the company, Katie Armendariz, is a friend of mine. If you ever need that connection, she really does emphasize hiring BIPOC folks to be representative of those that they serve.
Thank you for that recommendation, Brett. Can I hear from a representative from the Racism as a Public Health Crisis group? And just for the broader committee, we'll probably go to 803 to 804.
Hi, I'm Babette, and I'll try to be very efficient and concise with this. So we began our discussion with wondering and curious about whether there's any funding to support this work of racism as a public health crisis, and hearing that there really isn't a lot of funding in the department for this work. We wondered if there's an opportunity to connect with any of the COVID funding to support this work. And then we also are curious about what data the Department of Health has regarding race disparities in public health. And we feel like we need that data to identify an area to focus on. And that led us to the Center for Anti-Racism Research for Health Equity at the University of Minnesota. And so Rachel Hardiman Jones is the head of that department. And we thought it would be great if we could reach out to her and see if she and or her team could come to one of our meetings and share some of their data. They do have some good data on racial disparities for the state of Minnesota. We didn't see it cut by Minneapolis, but they may have the data cut that way. So we thought that would be a really great next step for us to develop our focus for this group. So Margaret, maybe we can talk offline, relative to whether the Department of Health has any, established connections with that department within the School of Public Health. A couple of us have some connections to Rachel, so we'd be willing to sort of partner in making that connection.
And what was the name of that department?
It is the Center for Anti-Racism Research for Health Equity within the School of Public Health. And she is an endowed chair by Blue Cross Blue Shield of Minnesota, made a $5 million philanthropic gift.
I think I heard her on NPR and she sounds legit. I will say to that subcommittee regarding funding, they're never gonna write you a blank check ahead of a solution. You first identify what you want, and then you tell them to go find the money, not the other way around. So don't tailor your conversation around what there is or is not funding for, because you're never going to get any money ahead of selling the product to council.
Jerome, that's really helpful because we had that conversation. What's first? What comes first? So very, very helpful advice.
No problem at all. And then from the final subcommittee that I was in, I don't know who took notes. Andrew, it looked like you were about to unmute. You didn't unmute though.
I would never take notes as well as Britt did, but that's a broader statement in general. I think just in the spirit of keeping it short for the end of the day, we were along the same lines, and I think having some education sessions for how people are approaching things from the provider perspective in the community, as well as some of the interesting idea that Jerome came up with at the very beginning was looking at how we can advocate for the gig economy folks to have access, not through rewriting laws or adjusting eligibility requirements, but rather asking employers or encouraging the city to require employers to do certain things, which would be kind of interesting too. And then we wanted to be educated before we did that.
Let's not make things happen.
I think we also had some discussion about how we can leverage the ARP funds for marginalized communities, because we were looking at access points within the folks who can't afford insurance that are working in service industry and gig economy, and then the folks that aren't working on the books, such as sex workers or other people who get their money under the table, so they wouldn't be able to access insurance that way, and looking at FQHCs or what NIP used to provide, but then also seeing how that connects to an overdose prevention site or safe consumption site, and having the providers that are representative of the communities that they serve and not having it be a financial barrier.
Woo! Good meeting, everyone. I hope you felt it was productive and that you were able to move forward on your established priorities. I know in our subcommittee meeting, we also discussed some things that would be very at home in the racism as a public health subcommittee. So hopefully there will be some emails flying over the next month. We all have a lot to talk about. Are there any final thoughts before I let you go?
I feel like I was right earlier when Babette was asking about if we're gonna have like with our own priorities and then having to figure out what. I have been hearing so much intersectionality where I don't think that there's going to be 3 competing priorities. I feel like within our subcommittees, we all have a very similar focus, but through different subcommittees that we would be able to intersect our ideas into something really cohesive from a committee as a whole. So that's really cool.
I look forward to that. That's going to be wonderful. Wonderful blending of the minds.
Heidi's typing something in the chat.
Oh, okay.
Just unmute yourself. Talk to us, girl. Oh, she just said thank you all. Okay.
Oh, wonderful. Great job,
Great
everyone.
meeting.
Thank you so much. I hope.
Thank you. Have a good evening.
Wonderful.
Thank you.
Bye.
Really great to see you all.
We'll see you guys in 4 weeks.
Thanks all. Bye.
Send those
Yeah.
emails. Hit reply.